Today on Cancer Buzz, an award-winning program that uses a smart texting system to reach high-risk patients. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This is the third episode in our six-part series on the 2024 ACCC Innovator Award winners. For 14 years, the ACCC Innovator Awards have recognized creative solutions in oncology from ACCC members nationwide. These awards also provide a chance for other cancer centers to benefit from these successes by replicating the innovations at their own programs. You can hear directly from these Innovator Award winners this fall at the ACCC National Oncology Conference. Today's guest joins us to share its innovation titled Smart Texting High-Risk Patients After Chemotherapy Reduces ED Visits. Michelle Eichelmann is the Executive Director for Oncology Services and Precision Medicine at Mercy Hospital in St. Louis.
It was really not a challenge. It was more of a regulatory, value-based medicine addressed need. So we have the CMS OP35 metric that is really triggering hospitals to look more proactively at how they manage patients to keep them out of the ED or inpatient admission. So that was the push behind our development of the predictive modeling system, which was the 2020 award. And then really taking that data and being able to utilize that really in the moment for patients is what led to our utilization of smart texting with our patients.
Can you talk about the impact of collaboration as you were working on this?
So the importance of having the team is that we needed, obviously, the build for the smart text to go out, the collaboration with our medical oncology clinics to work with our triage team, the medical oncologist to address symptoms in the moment, and then really looking to help standardize that approach to patient care. And then obviously the importance was our patient outcomes and the patient experience. So having our collaboration with our patient experience team, how patients received the text, and really meeting those patients where their needs were.
Why do you think it's important to attend NOC and gather with your colleagues in person?
I would say coming off of several years of our heads down in the trenches of COVID and really just doing everything virtual, I think that there's a personal connection that can happen in a national meeting that will help improve really just collaboration among other healthcare institutions, awareness of services or programs that are out there that would help institutions be stronger themselves, and then just really being able to glean best practices and have some collaboration and partnership.
So this innovation actually bounced off of another Innovator Award winner in a previous year. Tell us about that.
That innovation that was presented at 2020 NOC conference was about really the more of the meat behind how we developed the predictive modeling system. And the presentation in the 2024 NOC really is geared towards implementation of what do you do with that data. So I think that that would be really beneficial for other healthcare institutions to see how that data can be used. It's one thing to mine data out of our EMR, but to actually use it in a proactive approach to patients, I think is very unique. And so really, I think that's the key behind this one is not just data, but what do we do with the data?
Eichelmann will share more details on this innovation and how it allowed the cancer program to improve care of high-risk patients at the ACCC 41st National Oncology Conference, held October 9th through the 11th in Minneapolis. You can find a link to register in the show notes. Check out the other award-winning programs in this Cancer Buzz series. Make sure you're following the show by tapping the follow button and downward arrow on Cancer Buzz in your favorite podcast app. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.